John has presented with postural hypertension, which is an indication of circulatory volume deficit. A potential problem for this is that John may become dehydrated and can possibly go into shock. The nursing intervention to treat this is to monitor signs of fluid balance volume deficit. These signs will be seen in the patient having hypertension, and this will be done by keeping a fluid balance chart and daily weighs. The rationale for this is that monitoring fluid volume helps monitor for deterioration in fluid balance volume. John is on steroid therapy and is at risk of his BGL rising. The potential problem for this is that his BGLs can rapidly increase if it's not monitored. A nursing intervention would to monitor it 3 times a day. The rationale for this is that certain types of steroid therapy can affect BGL even if they do not have diabetes, and this will involve the doctor that prescribes the steroidal therapy. John has presented with fatigue and muscle weakness and will also be able to manage hygiene and will not be able to manage his hygiene on his own. A potential problem of this is that his skin integrity can become compromised, and so the nurses should give assistance with daily hygiene so that the patient maintains his skin integrity, as poor hygiene can open the doors to infection. John has a high temperature, which is a symptom of infection. A potential problem with this is that the patient may become immunosuppressed. A nursing intervention for this is to protect the patient against exposure to infection, and the rationale for this is that infection is a risk from corticosteroid therapy. John has presented with stress and lack of sleep. A potential problem of this is that he can be faced with overwhelming amount of stresses. The nurses should protect John from noise, light, and environmental temperature extremes, as he has an inability to produce corticosteroids, which means he cannot tolerate stress. John has a salt craving, which means his sodium and water levels are too low. A potential problem is that his sodium levels can become too low and he can become extremely dehydrated. The nursing interventions for this is to monitor salt intake and make sure it's adequate and that he's being administered IV fluids. The rationale for this is that sodium levels may get too low if your body is losing too much water, and this should involve a dietitian that the nurse should refer John to, as the dietitian will enable John to receive an adequate sodium intake.